He got trained in medical genetics from Adelaide University, Australia, St. John's Medical College, Bangalore, and Grand JJ Hospital, Mumbai. His pre-PhD VIDA and final PhD thesis in medical genetics are approved by MUHS. His PhD research topic is chromosomal variation in couples with history of recurrent miscarriages and chromosomy abnormal newborns. He is providing the medical genetic services to the patients from North Maharashtra region from last 13 years. He has a wide experience in the field of clinical genetics, reproductive genetics, cytogenetics, and clinical embryology. He is the founder president of Down Syndrome Care Association India. He is supporting about 250 families and children having Down syndrome in the state of Maharashtra. He has worked as a professor in medical colleges with a teaching experience more than 20 years. He had been recognized in various honors and awards at national level for his work. The various awards that he has received are National Medical Excellence Award, Bajaj Discover Positive Health Hero Award, Dr. Suresh Nadkarni Memorial Award by Maharashtra State IMA Chapter, Dr. Vasudev Rao Gupte Memorial Award by IMA Nashik, and many others. Dr. Chopde has remained as a faculty chairperson at many national and international conferences and workshops in the era of medical genetics. He has been interviewed by All India Radio, many television channels, newspapers, journals, many times for his expertise in the field of genetics Down syndrome. He has 6 research papers to his credit, and now others are in pipeline. He is an advisor to the government of Maharashtra for PCP&DT committee. He is honorary secretary of Indian Society of Training and Development. His research interest in the clinical genetics, cytogenetics, reproductive genetics is well known. Also to you that Dr. Dhananjay Chopde sir is known for his trekking habits. Many times he took us to the great trekking tours with lots of knowledge regarding the various animals and insects. He is having the love and affection towards yoga also. As a great mentor and a philosopher. So I welcome Dr. Dhananjay Chopde sir, and over to you, sir. So please enlighten the students.
Thank you so much, Sandeep sir. Thank you for that elaborative and beautiful introduction. Good afternoon, all. At the outset, I thank you for taking your time to join this session. It is wonderful to see so many of you, so many interns from various medical colleges across the state. With the kind of introduction that Sandeep sir did, let me give you some idea about what I'm doing right now.
Sir,
yes, sir.
Can I interrupt you for 1 second only?
Yes, yes.
Sir, sir, one small thing. Your lecture is going to be the last lecture in this 2 weeks e-lecture session.
Perfect. Okay.
Session. But on 18th, because on 17th there is a holiday, but on 18th, what we are planning at 2:30 p.m. Honorable Vice Chancellor, our own Dr. Madhuri Kanekar Madam is going to join online, and she is going to talk to the students. So just I want to convey all the SIP Center, Learning Gate Nodal Officers and SIP students. So you please join on time on 2:30. Our Honorable Vice Chancellor, Dr. Mudila Kanekar Madam, is going to bless you all. So that is the small message I want to convey. Thank you, sir. And you please carry forward. Thank you again.
Thank you, sir. Thank you. Yes. Okay. So, my role as a medical geneticist, I'm practicing medical genetics for the last 22 years now in Nashik and providing the genetic healthcare services in the state of Maharashtra. So what I do is we do the complete genetic health assessment, provide the genetic counseling, get all the necessary genetic tests done, offer the preventive measures, offer the appropriate management, and everything that comes under the banner of what we call as medical genetics. So that's my role as a medical genetist. Apart from this, I am a professor in the anatomy department of SMBT Medical College, Dhamangaon in Nashik. So without taking much of your time, let me directly get into the world of medical genetics. So can I share the slide, sir? Yes, thank you. Right. So can you see my slides?
Yes, sir.
Great, thank you. So the purpose of this talk is to introduce you to the world of medical genetics. So it is orientation to the field of medical genetics. And the specific learning objective at the end, you will be able to get a comprehensive overview of this most dynamic field and the world of what we call as medical genetics. You will be able to understand the significance of medical genetics in modern medicine, not only in modern medicine, but everywhere. You will be able to get present to how it can enhance your future, that you are going to become a doctor, how it is going to impact your practice in future. So I'm inviting each one of you to be fully present to what is there in this world, what is there for you, and what do you look forward to take from this in your practice. So when I'm presenting this, if you have any questions, I invite you to put these questions in the chat box. We'll be able to take the questions at the end. So participate in each and every session of this. So if we just have some snap view of what medical genetics is, it involves what it took for us to reach where we are right now, what we call as a historical perspective, the historical context. What is there right now in this field? So what is the current relevance to the practice of medicine and healthcare? And what are the real life examples? We'll be able to see some of the examples that you come across in practice or doctors come across in practice, and how this field is impacting the healthcare delivery. So let us get into this overview. So this journey started, we all are present. This journey started in the year 1860. That is what we know, with the work of Mendel on pea plants. And that's why rightly he is called as the father of genetics. He told us about the pattern of inheritances. He told us about the concepts of the autosomal, sex chromosomal, or dominant and recessive, and the pattern, how the information is passed down from one to the next generation. So it started there. Now, we are not going to cover each and everything, just looking at some of the important milestones. Fast forwarding in 1953, one of the very, you can say, the landmark discovery was the discovery of the structure of DNA. 1953, James Watson and Francis Crick, along with the Franklin Rosalind, they discovered the structure of double-stranded DNA. And they told us how the genetic information is stored and how it can pass down from generation to generation. Now, from 1953 till 2000, there are so many things that happened in the, you can say, the scientific world, especially the genetic scientific world. But we'll be switching directly to the Human Genome Project. Maybe you are present to that Human Genetic Project was one of the biggest projects that had happened so far. It took 13 years, thousands of scientists from different countries. And in these 13 years, we could reveal the complete information that nature has used to write our life, what we call as human genome. And that was the beginning of, you can say, a new hope, a new era of genetics. Looking forward to having the very innovative therapies, gene therapies, very innovative modalities of diagnosis, treatment, management, everything. From 2000 to till date, there are so many, it is advancing so fast that it is becoming very difficult for each one of us to keep pace with the scientific discoveries. It has advanced to such a level that when I started my practice in 1992, when I was in Government Medical College and we had the cytogenetic laboratory, looking at the chromosome and identifying the chromosomal abnormality was something wow kind of thing that time. We didn't know about the many of the genes. We didn't know about most of the genetic disorders. We didn't have any idea about what other tests are involved in diagnosis of the genetic disorders. We were happy with identifying the chromosomes. But now, from chromosome to the molecular level, we have advanced so fast with so many technologies. And right now, we are actually using the knowledge of genetics in day-to-day practice in each and every specialty of the healthcare delivery. Currently, you can see that most of the genetic disorders, which are known to be more than 10,000 reported, can be diagnosed at molecular level. And we're talking of treating them. Rather, not only treating them, we're talking of curing them. So far, we don't have cure for most of them, but we have started talking of that. We have started bringing in some therapies, gene therapies and advanced therapies for some of the disorders. And that's very fulfilling and promising. With the kind of technology we have in genetics, we're talking of the future, which is so much promising. Not only about the diseases, we're talking of enhancing our own potentials, going beyond our limitations as human beings. So that's what the world of medical genetics is. The second part of this overview of the medical genetics involves how it is relevant today. So if you look at the current relevance right now, what is there in the practice of medicine from the world of medical genetics is we can understand the molecular basis of most of the diseases and even the health. This helps us to enter into the world of what we call as personalized medicine. We can go for early diagnosis and prevention of the complications of most of the diseases. We can even prevent the birth of the abnormal babies. It has revolutionized the world of cancer treatment through cancer genomics. Genetic counseling is a mainstay in the area or the field of medical genetics, whereby we can create a kind of space for people through counseling, wherein they can live life happily, powerfully, peacefully, with or without treatment. A lot of research and innovation is happening, and it is impacting the overall public health in the country and the world. Let us look at these points one by one. So if you look at the understanding of disease mechanisms, not only disease mechanisms, but the health. When we define health from the perspective of WHO, from all the angles, like physical, mental, social, and even beyond that, maybe we can talk about the spiritual. But for now, just get present to understanding the disease mechanisms. So by doing the genetic testing, identifying the genetic mutations, it has become possible for us to pinpoint the error, to pinpoint the root cause of the disorders. And this is very crucial in developing the targeted, specific treatment and preventive modalities. We'll be looking at this. What does it mean subsequently? The second point is personalized medicine that we talked about. So what personalized medicine is? Like if you are having some infection or some disease or some health condition, specific health condition, looking at your genetic profile, now we can think of prescribing a very specifically designed medication for you only, which is highly effective and which will cause minimum side effects. So it improves the efficacy of therapies by minimizing the adverse effects, by tailoring the specific treatments specific to your gene profile, genetic makeup. So this is the field of what we call as pharmacogenomics, which is evolving very fast, and that's very, very promising. The third part, current relevance, and what is happening right now in the world is we can do the early diagnosis and prevent the consequences or prevent the occurrence or delay the occurrence or even prevent the birth of the babies with genetic abnormalities by doing the early diagnosis. Now, just as an example, if you just look at the newborn screening happening there in the hello. If you know about the prenatal screening happening, at birth, the infants are screened for some of the common genetic abnormalities, which are very common in our country and the world. And by doing the early diagnosis, we can actually do the early intervention and prevent the complications which can happen later if we don't diagnose it at the earliest. The best example is phenylketonuria in the newborns. Phenylketonuria is one of the very common conditions that we see in India and world. And if the baby is born with this condition, the baby, if untreated, will result into severe intellectual disability. A simple screening program, if tells you that the baby is having phenylketonuria as a condition, by offering the phenylalanine low diet, we can prevent the complications. Like we can prevent the intellectual disability which otherwise would have happened, and the child can survive and live a normal life. The very powerful impact of the early intervention that is right now in the practice. The next field is of current relevance is that of the cancer genomics. So if you look at what is happening there in the world of cancer diagnosis and treatment at both levels, at the level of diagnosis, we are being able to very specifically pinpoint what is the cellular or genetic error which led to the cancer. And second thing, based on that, we are prescribing a very specific treatment which will kill the cancer cells and protect the rest of the body cells. And at the same time, we are being able to predict what is going to happen. So it has got the diagnostic modality, it has got the diagnostic significance, it has got the treatment significance, and it has got the prognostic significance also. What we define as precision medicine, the precision approach in medicine is this. So this is revolutionizing the cancer medicine in a huge way, what we call as cancer genomics. Genetic counseling. So we'll find that counseling is one of the very, very important aspect of healthcare delivery, which is currently missing in most of the specialties. But as far as genetics goes, as far as medical genetics goes, counseling is one of the most important part of the overall healthcare delivery in the field of medical genetics. What does it involve? It involves actually understanding what the concerns of people are when they come to you with a specific complaint, specific concern. They want something, they don't want something. With all those concerns, we are getting the whole information, charting out the pedigree, getting the family history, then doing the physical examination, doing the review of the literature, doing the specific tests required, and then coming to the diagnosis and offering them whatever is available to deal with the situation so that they can live happily, powerfully, and peacefully is what genetic counseling is. This involves pre-test as well as post-test counseling. And my experience of this for so many years is genetic counseling can actually impact people very, you can say, very powerfully. Whether there is a treatment available or not, you can actually create a space where people can live happily, powerfully, and peacefully. So that is the power of genetic counseling. And based on the accurate diagnosis, it is becoming more and more precise and more empowering. So this is getting involved in each and every aspect of the medical genetics that we'll be talking about. What are the different aspects? Research and innovation. So as I said, currently in the world, you will see that most of the funds from the research centers and the research agencies are going towards finding out the innovative ways of avoiding the age-related conditions, avoiding the complications of the genetic disorders, treating the genetic disorders. But beyond that, most of the resources are going towards living healthy life, happy life, and living longer. And that involves the tremendous research in the field of medical genetics and genomics. Maybe most of you are aware of the advanced technologies, what we call as CRISPR-Cas gene editing, which promises us curing the diseases. So currently we are talking of treatment of the diseases, prevention of the diseases, but at the same time, we have started thinking of empowering our own selves, normal selves, enhancing our own potentials by doing the genetic manipulations. That is one of the aspects of the innovation and research that is happening there in the world. It is also impacting the public health. You are aware of what is happening there in the community. So by doing the research, finding out what are the common conditions happening there in the world, designing a population-based screening programs, and designing the strategies also to prevent the incidence of the disorders in the community. This way, we are trying to reduce the impact of the overall health impact of the genetic disorders or the disorders which are caused because of the genetic errors. So it is also impacting the public health. So this is the one aspect of the relevance, the overview of the medical genetics, current relevance. We have seen historically how we reached here. We have seen just now what is there for us at present in the modern health. And third aspect, we are going to look at some of the common examples of real life examples of the utility of medical genetics in practice. So here you can see here the picture of Angelina Jolie. Maybe most of you are aware of her. She is a world-renowned actress. And now she is in news for the last few years because she took decision of removing both of her breasts. She underwent the bilateral preventive mastectomy because in her family there was a history of breast cancer, and she was worried. She tested herself for the mutations and she was found to be positive for BRCA1 gene. BRCA1 gene, we know, is the normal gene which produces the protein which can actually help in restoring the DNA, repairing the DNA, which happens naturally in all of us. But if there is a mutation in this, it can result into accumulation of the damaged DNA in the body, resulting into cancers, especially the breast cancer and ovarian cancer. With the information that she got out of this, having a very high risk of developing breast cancer in her lifetime, about 80% risk it is associated with, she decided to remove both her breasts. And actually, she brought the, you can say, this message to the world. It is better to go ahead with the testing if you are at risk or if there is some family history. Better to go ahead with the genetic testing and take the preventive measures. This is a real life example. And this is real life example I'm giving you because she is the celebrity, and she has actually created a lot of awareness about the cancers in the world. Newborn screening. So you must be aware in your curriculum now newborn screening is added, and we are adding more and more tests in the newborn screening, especially the metabolic disorders. When an infant is born, and if we test the infants for the common metabolic disorders, and if we find that the infant is a carrier or affected with some of the metabolic disorders, metabolic genetic disorder, by doing early intervention, we can actually prevent the complications of the condition. As an example, as I said, phenylketonuria is a very beautiful example. If untreated, very soon the baby is going to have a very severe intellectual disability. But if early identified, we can what we can do is just provide the low phenylalanine diet, and the baby can survive well normal life. A very, you can say, a beautiful example of the power of medical genetics and early testing. Personalized treatments. So if you look at the example of cystic fibrosis is one of the very lethal condition which impacts the respiratory and the digestive functions by producing the mucus, and it can actually cause very much compromise in the functions of respiratory and the digestive systems. In certain cases of cystic fibrosis with the specific mutations, we have the drug, a gene therapeutic drug called as ivacaftor, which improves the life, you can say the quality of life for these children with cystic fibrosis tremendously. That is one of the another real life example of the power of medical genetics and diagnosis. Maybe some of you are aware of the spinal muscular atrophy and the news that are coming there in the newspaper and television and on the online media. Spinal muscular atrophy is a very lethal condition, and some of the types of the spinal muscular atrophy are very lethal. It results into, you can say, very weak weakness of muscles, hypotonia, severe hypotonia, and the muscle atrophy. And usually the severe kind of spinal muscular atrophy, the babies do not survive beyond 2 years. Now here is the hope that is coming from the gene therapy. And there is a one-time gene therapy. This is one of the best things. There is one-time gene therapy called as Zolgensma, which can actually improve the quality of life of these babies. You must have heard in the last three years back, there was one of the family from Pune who actually collected around 18 to 20 lakh crore rupees to treat their child with spinal muscular atrophy. So this is the era where the gene therapies are coming into the practice, and slowly people are getting aware. And though the cost of the treatment right now is huge, but one thing is for sure, there is a promise, there is a potential, And it is not only for specific conditions or some conditions, but that potential and promise is going to be for most of the conditions that we are dealing with. And the last one here in the real life examples is like in conditions of cardiovascular disorders, wherein if, for example, there is a history of heart attack there in the family, by specific testing, you can find out whether the particular family or a person is carrying a specific gene variant which can metabolize the specific blood thinners. You can prescribe a specific drug in a specific dosage. So that is what the example of pharmacogenomics is in real life examples. Another example we have seen is cancer genomics. So there are so many examples, but these are some of the real life examples of the relevance of medical genetics. So I'm inviting each one of you as I'm going through. If you have any questions, you can just note down, put in the chat box so that we can take those questions at the end. Am I audible? Arogya Dham, can you put on yourself on the mute? Am I audible?
Yes, sir.
Yes, good. So can you put people on mute if those who are not?
Okay, sir, no issue.
Yeah, thank you. And my request again to the participants, as you go through, maybe there are a number of questions which are cropping up. Don't let them go. Just put it on a piece of paper or you can put it on the chat. We can take those questions at the end. I'm very sure that most of you, those who have joined this, are curious to know what is there in the field of medical genetics. What is there for you as a student and as a doctor to be. So just get present to whatever questions you get. The second most important part of the orientation of medical genetics is looking at the common terms that we use to navigate in the world of medical genetics, describe the world of medical genetics, communicate in the world of medical genetics. So we are looking at, as far as key concepts are concerned, there are basic terminologies. So very few terms we'll be looking at. Then we'll be looking at the common genetic, very few common genetic disorders, just to give the idea and the test of what the world is. And then the some little idea about the genetic testing that we are using right now. So going to the first part, the basic terminology, maybe that most of you are aware and you might find it is very primitive, but still I am inviting you to look at it from a newer perspective. You all know what chromosomes are. We all have inherited 23 chromosomes from our parents. So 23 chromosomes in pairs. All our body cells, except the gametes, they have these 46 chromosomes in 23 pairs, of which first 22 pairs are what we call as autosomes. And the last pair, in case of male, which is X and Y, in case of female, it is both X chromosomes, is called X chromosomal pair. All these chromosomes are present in all the body cells except the gametes, where there is a single set of chromosomes, only 23 chromosomes, and they are recombined. Whereas in the rest of the body, we expect all the chromosomes, 46 chromosomes in every cell and similar type of chromosomes, right? So this is a basic understanding, and these are present in the nucleus. And we can see the chromosomes only when the cell is dividing. So there is a specific process to check for the chromosomes, what we call as karyotyping, that you must have gone through in your first year of studies. DNA and gene. You all are aware of what DNA is, deoxyribonucleic acid. So if you look at the chromosome and just pull the chromosome end to end, the chromosome here shown is double-stranded, which in the normal functioning cell is single-stranded actually. If you pull that chromosome end to end, you will see that it is made up of a very long thread of DNA, deoxyribonucleic acid, with the proteins, especially the histone proteins. And this DNA is double-stranded, and it is composed of the base pairs, adenine, thymine, cytosine, and guanine. So we need not go in details of that, just to get present to the understanding of this organization. And on this long thread of DNA on each chromosome, so there are 46 threads of DNA which are compacted to make the identifiable thread-like structures, which when stained with specific stains and seen under microscope are seen as chromosomes. These DNA threads, end to end, have a very specific sequence of DNA. And on this long thread of DNA on each chromosome, there are certain segments. So as you can see in this image, a specific segment which is involved in coding for a particular protein, a specific protein, is what we call as a gene. So each gene has a very specific sequence of the DNA, which you can say encodes for a specific messenger RNA, and through which it can encode for or make the specific protein. That protein which helps either in the formation of structure or in the function of the living. And all these genes that we know for now, there are about 20,000 few hundred genes present in humans which are controlling our existence from beginning to end, from conception to death. As an example, you can make here, you can see here, as we have seen BRCA1 gene, you can see here on chromosome 17, at a specific place, there is a segment of DNA. This DNA is what we call as BRCA1 gene, and this makes a protein. This protein helps in repairing the DNA. So if there is a mutation here, it results to cancers, as we say, maybe especially the breast cancer and the ovarian cancer. The term mutation. Mutation means the permanent, irreparable change in the sequence of DNA. So it can be defined as any change either in the number or structure of chromosomes or DNA, chromosomes or genes. Any alteration. Now, some of the alterations are, you can say, benign. They don't cause any problem. So we call these as a non-pathogenic or neutral mutations. And mutations or the alterations in the chromosome number, structure, or the genes which result into the manifestations of diseases are called as the pathogenic mutations. Example here you can see, as far as the chromosomal mutations are concerned, the number of chromosomes being more or less than the normal 46. So one of the example is Down syndrome, which is caused because of extra chromosome 21, called as trisomy 21. Another example in the structural defect in the chromosome as a mutation is deletion 22q, so which results into DiGeorge syndrome. Gene mutation, one of the example is CFTR gene, which can result into a disease called as cystic fibrosis, one of the lethal disease. So far that we know, such kind of mutations, either in chromosomes or genes, cause around 10,000 different, more than 10,000 different genetic entities which are known there in the living. Allele. So we have seen in the previous slide, you can see here in this slide that at a specific locus on a specific chromosome, at a specific site, there is a sequence of DNA which we call as a gene. This specific location is called as a locus. And as we have the chromosomes in pairs, so if there is chromosome number 3, one chromosome coming from mother, another from father. So on this 3, at a specific point, there is a gene. On the other also, at the same site, there is the same gene. Gene coding for a particular trait. Now this can be, though the gene is coding for a specific trait, there can be change in the sequence of the DNA there. We call these variations as the alleles. So you can see here in this specific sequence, this is allele 1 and this is allele 2. This is a specific locus at a specific site. So these are two different alleles. So at a given point on the chromosomes, maybe that both the chromosomes have the same sequence of the gene, same structure of the gene. These are called as the same, this is one allele only, and the condition is called as homozygosity. In the maybe there is another part of this in another person at the same locus. There is a different sequence, little different sequence, but on both chromosomes it is the same. It is also called as homozygous. So this is homozygous autosomal dominant. This is homozygous autosomal recessive. But here you can see on one chromosome there is a normal gene, maybe you can say, and on the other there is an alteration in the sequence of that gene. So here we call this as the dominant, and this is recessive. At the same locus, same gene with different variations or different, you can say, variants. These are called as a heterozygosity. The condition is called as heterozygosity, and the person, such person having the variants of the same gene is called as a heterozygote. Next term that we encounter is genotype, phenotype. So genotype is the genetic makeup of the individual, maybe the whole makeup or maybe the makeup for a particular trait. And phenotype is the expression of the genome in the form of the living being as a structure and the function. So like here you can see, this is a genotype showing the 47 chromosomes with one extra chromosome 21. This is what we call a genotype. And the phenotype will be Down syndrome, wherein the child is having the specific, you can say the physical expression, mental expression, social expression, right? Developmental delay, muscle hypotonia is there. There is intellectual disability. It is multi-disability condition. Another example you can see here on chromosome number 4 on T arm at a specific point, you can see here one of the gene is showing the error, FGFR3 gene. Other gene on the other chromosome, the same gene on the other chromosome is normal. So this is what we call as a genotype, wherein one of the gene is mutated, the other is normal. So this is heterozygous. And since we know that this FGFR3 gene mutation is inherited in the autosomal dominant fashion, it results in the disease even if the single mutation is there. This is the phenotype, what we call as achondroplasia. FGFR3 gene mutation resulting into a phenotype, what we call as genetic condition, as the phenotype achondroplasia. The next term that we use very often is pattern of inheritance. So as we started with, Mendel gave us the patterns of inheritance. He defined the terms recessive and dominant, and whatever we are using right now to describe the pattern of inheritance, Mendelian inheritance especially, autosomal, the chromosomes, autosomal chromosomes from 1 to 22. So the genes present on these chromosomes are called as autosomal genes. Genes present on the sex chromosomes, X and Y, are called as sex-linked genes. And we are using these terms, autosomal dominant, to define a condition which is inherited from one to the next generation, and a condition which is the disease which is happening even if a single gene is mutated. That is autosomal dominant. The gene is present on autosome and it is causing a disease even if it is mutated in one copy. Autosomal dominant conditions. Such conditions are inherited from generation to generation, and the risk is 50% every time. 50% risk of having a child with similar condition. Another autosomal recessive, wherein we see that generally it is not seen there in the earlier generations. The parents are carriers for the mutation. They are carriers for the autosomal recessive, meaning one copy mutated will not result in a disease. If both copies are mutated, it will result in a disease. Such parents which are carriers for autosomal recessive disorders are at risk of having a child with the recessive disorder, autosomal recessive disorder. The risk is 1 in 4, that is 25% in each pregnancy. In X-linked conditions, most of the conditions, what we call as X-linked or sex-linked, are X-linked recessive. And herein, usually it is a mother who is a carrier, unaffected, usually unaffected, and she inherits the disease only to her sons. Every time the possibility is 50% possibility that she will inherit the disease to her sons. And she will inherit the mutation to her daughters also. There is 50% chance that the daughters will not be affected. Another inheritance pattern that was added later was mitochondrial inheritance, wherein we see that the genes which are present in our mitochondria, if there is any mutation, it results into diseases, mitochondrial diseases. And we all inherit our mitochondrial genome from mothers only. So mitochondrial inheritance is called as the maternal inheritance. And usually all the babies are expected to be affected. But because of the variability, there is a lot of variability in the presentation of mitochondrial disorders. We never see a family with a mother being carrier for the mitochondrial mutation and all the babies affected with that. So these are some of the terms that we use, patterns of inheritance. So with the basic terms, let us look at some of the common conditions just to get a test of what is there in the field of medical genetics. So as I said, there are more than 10,000 different diseases, genetic diseases, which can be identified, diagnosed with genetic tests, and described. We are looking at very few just to get a test of the world. Down syndrome, very commonly seen condition, which is caused because of extra chromosome 21. So you can see here there are 47 chromosomes and one chromosome 21 extra. It can be either in 3 separate copies, or it can be one of the chromosomes is attached to some other chromosome, called as translocation Down syndrome. Results into multiple disabilities. Very commonly seen is the developmental delay, intellectual disability, learning disability, the problems with the stature, short stature. There is, you can say, the structural defects that we know are like the small posteriorly rotated ear, open mouth, tongue is coming out, nasal depression is there, The eyes are slanted. There is palpebral fissure slant. There is epicanthic fold. You can see the single palmar crease, simian crease, increased distance between the great and the second toe. And there are so many. There is endocrinal problem. Some of the babies, around 40% of them, will have the heart defect. Multiple system involvement, one of the commonly seen condition in practice. And if those who are interested really in the world of medical genetics must get present to that most of the people in medical practice, most of the time are talking only about Down syndrome. For a simple reason, the condition which can be prevented, very commonly seen, and it can be screened. So in all the pregnancies in the world right now, there are screening procedures which are focusing mainly on prevention of the Down syndrome. So a lot of discussion happening in the world of medical genetics is around very common conditions, and of that, Down syndrome is the commonest. Another condition, let us look at cystic fibrosis, as we have been discussing it. One of the very lethal genetic disorder, which is inherited by autosomal recessive pattern of inheritance, with a risk of 25% in the children when parents are carriers for this. Lethal in a sense, it impacts the respiratory function. It impacts the digestive function. It's life-threatening in most of the babies. And it is caused because of mutation in the gene called as CFTR. This gene mutation results into production of very thick and sticky mucus. Now, wherever the mucus is formed, very thick and sticky, it blocks the passages and thus hampers the function of respiratory system as well as all the passageways in digestive system also. It increases the possibility of infection because of this blockage and the trapping of the bacteria. Frequent lung infections, pneumonias, and the babies, most of them will die because of the pneumonia and the infections. Patients will require daily treatment, daily management, daily monitoring. So severe the condition is. Cystic fibrosis. Another one, sickle cell anemia. Maybe that most of you are aware of this and you have heard and read about it a lot many times. Sickle cell anemia is a condition wherein the red blood cells, they become sickle cell in the stage of crisis. And because of that, they can block the blood vessels, especially the tiny blood vessels, resulting into pain crisis due to ischemia to the different parts, distal parts especially. Joints, increasing susceptibility to the infections, severe anemia because of the damage to the red blood cells. It is autosomal recessive condition again. Usually parents are normal, healthy, but they are carriers and results in this condition. Some of the communities in India and the world are very prone to, and they are having a very high incidence of sickle cell anemia. This is one of the commonly discussed conditions in the world of medical genetics. Huntington disease. One of the age-related degenerative disorder, neuron degenerative disorder, which is inherited by the autosomal dominant fashion, caused because of mutation in a specific gene HTT, resulting into degeneration of the neurons and especially impacting the basal ganglia of the brain, and that results into so many disabilities. There is impaired coordination, rigidity and tremors, there is slurred speech, uncontrolled movements, fatigue, even there is behavioral and emotional, you can say, disturbance. It results into behavioral and emotional disorders also. So one of the very commonly discussed condition, and a lot of focus in the world is happening to find out the cure for such conditions. Huntington disorder. Marfan syndrome. Marfan syndrome is again one of the, you can say, autosomal dominant condition with a chance of 50% inheriting to each baby, male or female both, located on chromosome 15 and is caused because of mutation in the gene FBN1. And it results into especially the skeletal deformities. So you can see here a picture showing the deformities, like there is kyphosis, scoliosis, there is chest is depressed. There you can see there is a disorder of the collagen and the bones. So it results into subluxation of the lens. Retinal detachment can happen. There can be cataract. There is a altered shape of the head called as dolichocephaly. There is aortic aneurysm. floppy valves resulting into the incompetence. So there is a specific you can say the phenotype which is called as arachnodactyly, resulting into long fingers. So there is a the limbs are longer as compared to the normal people, and fingers, they are longer than usual. So this is one of the condition which can become very lethal if there is a vascular involvement resulting into the aneurysms. So some of the common conditions that we have seen. Now let us see how do we test. So there are some of the world of genetic testing in the world of medical genetics. What is genetic testing? So any test that looks for the chromosomes or part of chromosome or gene sequencing, maybe the whole of the genome or a part of the genome, is called as a genetic test. Maybe a test which can even look for the products of the genes like messenger RNAs or proteins or various enzymes. Any kind of testing which will help us in diagnosing a genetic disease will be called as genetic testing. So here you can just look at the flow. So when a patient comes to a clinician, a doctor sitting in the clinic, sometimes the doctor gets an idea about that the condition seems to be genetic in origin. And then he might refer the case to the clinical geneticist or medical geneticist. A medical geneticist is the one who can actually do the in-depth assessment from genetic perspective of any individual and look at whether the condition in concern seems to be genetic or not. And by going through all the relevant details like the family history, pedigree charting, the clinical examination, physical examination, all the investigations which have been done earlier, looking at all that, going through the review of literature, he can come to the probable diagnosis. And then he can prescribe the specific genetic tests, which can either confirm or rule out the disease. And then collect the samples, send the samples to the reference laboratory, get the investigation done, interpret the investigation, interpret the report of that investigation in context of the presentation of the patient, and then provide the appropriate counseling, treatment if available, support, prevention, preventive modalities, and all the options which can actually make them live happily, powerfully, and peacefully. So here are some of the tests which are given that can be prescribed and ordered. Chromosomal tests involve karyotyping, FISH testing, which is called as fluorescence in situ hybridization for specific chromosomal numerical or structural abnormalities. Then microarrays to check for the microdeletion syndromes. We can check for a specific gene variant, a specific gene sequence from end to end. We can check for the panel of genes responsible for the common presentations. We can check for the whole genome, called as whole genome sequencing. We can check for the specific exome, so all the genes and their exomes only. And we can even check for what we call as clinical exome. So we are checking for the exons of the genes, which usually result into the clinical manifestations. Then there can be investigation for genomic imprinting, called as gene expression testing. It can be biochemical testing. It can be testing for a specific protein as a product of a gene. So these are the various kinds of tests which usually in the world of medical geneticists, a medical geneticist can prescribe. A common physician cannot do all this because that's not part of the routine practice. But getting present to that there are different tests available to diagnose or rule out a specific condition is necessary for each and every clinician. There is no field right now in the healthcare where a clinician can say that I need not have the knowledge or the basic understanding of genetics. You have to have, you can't escape to have the basic understanding of genetics and its implications and applications in the current world. So when we started with the genetic testing, this is a diagnostic testing, right? So genetic testing can be diagnostic, wherein we confirm or rule out a specific condition in a particular affected individual. Sorry, let me just say it again. By mistake, I stopped it. Oh. Okay, can you see that? Yes. Okay. Another type of the genetic testing could be predictive and pre-symptomatic. Predictive in a sense, people are worried that they might develop some disease. In general, not specific. So like yesterday, I got one person from the army. He was talking about, I'm worried about whether I'll develop a mental disorder. There is no family history of mental disorder in his family. There is no family history. But still he was worried and he wanted to know whether he is at risk of developing the mental disorder. This is predictive, whether he is likely to develop into the future. Pre-symptomatic. So in some families, there is some disorder which is inherited and it is likely to happen in the later age. So people are worried whether they will develop the disease and whether they are the carriers for the gene mutation. That is called as pre-symptomatic genetic disorders. Now here is one of the example you can see. Here in this family, this is the example of pre-symptomatic testing. So you can see here this in this pedigree, there's 3-1. This lady is having the breast cancer. She came to the genetic clinic to find out whether this breast cancer has happened because of the genetic mutation. So she was tested. Genetic testing was done for BRCA1 and BRCA2 gene, and she was found to be carrier for the BRCA1 gene variant, pathogenic gene variant. So this is a diagnostic testing. Now that when history was taken, it was found that her paternal mother died of breast cancer. So we assumed that her father was a carrier and who inherited this mutation to her. And we advised the testing of the father. Again, the testing of father is diagnostic. We found out that he is having the same mutation. From mother's side, we need not test anyone. Now, with this history, again, we got the history that her paternal aunt also died of ovarian cancer. Now, there are so many other people. Her paternal uncle and paternal aunt and their children, are they at risk of having the breast cancer or ovarian cancer? So we advised and prescribed the testing, and when tested, those who were interested were tested, and we found that 3 people, this 3, 6, 3, 8, and 2, 5, these people were the carriers for the BRCA1 gene. So this kind of testing is what we call as predictive testing, wherein they are predicting. Now with the BRCA1 gene mutation present, sometime in the lifetime, there is a possibility, 80% possibility that they will develop the cancer, either breast or ovarian cancer. The third type of testing we have is carrier testing. So what is carrier testing is, the carrier screening is to identify the people, individuals or couples who are unaffected. They are not having the disease, they are unaffected. Are they at risk of having a child with an autosomal recessive or X-linked genetic condition? So carrier testing is relevant, especially for autosomal recessive and X-linked recessive conditions, because it is not seen in the people in autosomal recessive conditions. In heterozygous state, people are not affected, so they don't know whether they are carriers and whether they are at risk. X-linked conditions, females who are carriers, they don't know that they are carriers, but they are at risk of inheriting the condition to their sons. So this is what we call as carrier screening, carrier testing. So here is one of the examples. You can see here the pedigree. Carriers, the parents both are carrier for the same mutation, and there is a risk of 25% of inheriting the condition to one of their child. Out of 4, one of the child might get affected because of the condition, irrespective of the sex. So this can be done when there is a family having a child with a specific genetic condition known to be autosomal recessive, or even in families who are very closely related by blood. In couples having consanguineous marriages, there is a very high chance that they are the carriers for the autosomal recessive mutations and at risk of having a baby with genetic disorder. So couples with consanguineous marriages, individuals in a specific communities, like in India and the world, we know some of the communities who are having very high incidence for some of the autosomal recessive conditions, like thalassemia. Thalassemia is very common we know in India in the Sindhi communities. In South African communities, very common. So in certain communities, we can do the screening without they being affected to find out whether they are carriers and whether they are at risk of inheriting the condition to their children. And this helps us to prevent the birth of the abnormal babies. In X-linked conditions, usually in families where there is a history of some of the X-linked genetic disorders. In such cases, the female at risk should be investigated to find out whether they are carriers, and if they are, then they can be advised to go ahead with the preventive measures to prevent the birth of the abnormal babies. Examples here: Duchenne muscular dystrophy, very commonly seen in our country, Fragile X syndrome, where the mothers are not aware at all whether they are carriers or not. And suddenly, when one baby is born, then they get aware, and then nothing can be done about it. As far as these conditions are concerned, right now we don't have any treatment, any therapeutic or curative treatment available. So the prevention through carrier testing is one of the very important part of medical genetics. Prenatal testing, another kind of genetic testing, wherein the couples who are at risk of having a baby with genetic disease, in them we prescribe, we advise, we recommend the prenatal testing. When the mother is pregnant, during pregnancy, we do the prescribe the testing, and by taking the samples of the fetus, placenta, or amniotic fluid, we can actually test for the condition in concern, the condition for which the fetus is at risk. This is to detect if the fetus is affected or not. And if the fetus is affected, there are two things. One, either we advocate termination when the condition is likely to be very lethal and is likely to compromise the life, or two, we can get ready as soon as the baby is born, we can get ready to deal with the situation so that the baby can live happily and powerfully. So these are the various preventive modalities that we routinely practice: chorionicular sampling, amniocentesis, chordocentesis at different ages at different gestational ages of the pregnant mother. Another part of genetic testing is newborn screening. So consider every day in India we have around 70 to 80,000 babies born, and consider the possibility we are screening all of them for the common genetic conditions, and we identify those who are actually having the gene mutations and are likely to develop the disease, and the conditions which can be prevented, which can actually be managed well by doing the screening and early intervention. Here are some of the conditions which are enlisted. So you can see congenital hypothyroidism, G6PD deficiency, congenital adrenal hyperplasia, tyrosinemia. Here is a list of the conditions. Phenylketonuria, as we have discussed. So if you look at congenital hypothyroidism, which can result into the huge babies, you can say it can result into mental retardation. 1 in 1700 is the incidence in India. So just look at the total number of babies born with congenital hypothyroidism. Unless we have an idea prenatally that the couple is at risk, we are not going for prenatal diagnosis. So the babies are born, and once they are born, if we identify early and if we prescribe thyroid treatment, then these babies can survive well, they can live normal life. But if we don't do, they are going to result into mental retardation. Pharmacogenomic, as we have seen it earlier also a number of times, just look at this. Consider, for example, this cohort of the population, and in this population, there is a specific condition, disease happening to all of them, and we do the genetic profiling. We find out a particular drug is suitable or not. We'll be able to actually identify some of them where they will not be actually responding to the drug. Some of them will be very well responding to the drug in a specific dosage, and maybe some of them will have very severe adverse effects of the drug. So we can, by doing the pharmacogenomic testing, what we call as a precision testing, by identifying the mutations or variants, prescribing a specific drug in a specific dosage. That is what the world of pharmacogenomics is. So with all these types of genetic testing in different domains, let us look at the significance. Genetic testing in the world of medical genetics allows the timely interventions, and that can significantly improve the outcomes. It helps us to select the specific or targeted therapies and improve the efficacy and reduce the side effects. It helps to decide on the different kinds of options available, explore the various options, like especially in the reproductive part, like prenatal diagnosis, pre-implantation genetic diagnosis, donor eggs or donor gametes. It also helps guide treatment strategies and anticipate the disease progression. So these are the various parts of significance. Sandeep sir?
Sir, shall I request students to start their video, please? So image.
Yeah. So do I have a specific time limit?
All should
How
start
much
their
time do I
videos.
have?
Sir,
Sandeep sir?
So actually, I am requesting over the 3:30 afterwards. There is another meeting is scheduled.
Okay. So within 5 minutes, I'll wind up.
Yes, sir. Please.
Okay, perfect. Thank you. Yeah. So actually, this is what we have earlier seen. I'm not going in details of the therapeutic modalities. Gene therapy is which is coming, and as we have seen, one of the example is SMA1 gene, where there is a Zolgensma. Actually, in practice, CRISPR-Cas9 gene editing technology, it is very specific, and we can use that for targeting the specific gene mutations. Here is a news of the FDA approval for the sickle cell anemia, gene therapy for sickle cell anemia. We have the RNA-based therapies, pharmacogenomics we have seen. So you can see that the application of medical genetics is in number of areas and in each and every specialty. This is to screen, detect early, modify the life, prescribe the specific treatment, avoid the birth of abnormal babies, and provide the very specific treatment modality in conditions. So here are some of the, these are the words that we have seen earlier. In future, let me give you some idea. We have seen the gene sequencing, CRISPR-Cas9. We have the possibility of testing any disorder by checking single cells. That's one of the very revolutionary, you can say, innovation that is going to happen. We are waiting for the artificial intelligence and machine learning to actually encroach and actually help us in analyzing the vast data which is generated, vast genomic data that is generated, to identify the patterns and make predictions. What is likely to happen in your lifetime, whether you are at risk of something, what drugs you are you can have without side effects, and best treatment you can see. Liquid biopsies, wherein a single drop of blood will help you to get every information about your life. And even we can talk about the very wearable genetic devices, which will help us monitor our physiological and genetic parameters. Ethical considerations, we are not going to go in details. So these are very significant in the world of medical genetics: privacy, confidentiality, informed consent, genetic discrimination, equity and access to all, reproductive ethics, and gene editing and germline modification. This is going to happen, and the world is going to change very fast in the coming days. So with this, I stop, and if you have any questions, we can take the questions, or if you don't have time, then we can stop here. You can write me, and I can answer your questions also. So is it okay, Sandeep sir, we take the questions?
Thank you, sir. Thank you very much, sir. Such a elaborative and very
Can
good
we take questions?
I must say the presentation given by you is the excellent presentation I had also seen so far in the field of genetics. So I request to the students, if they are having their question, they can raise their hand. Sir, screen share cut kar dijiye, screen share.
Yes, I'll do that. Thank you.
So all the students, please start your video. And if you want to ask a question to our Dhananjay Chopre sir, so you are at liberty. You may ask. You just raise your hand so that I will unmute you.
I want someone who can give me feedback about what did they get out of this last 30-40 minutes.
Yes. From RC Nagpur, Bhosle sir. Any student from RC Nagpur wants to give their feedback?
One moment, sir.
Okay. Tabassum, you want to say something? You please.
Sir, they don't have any questions.
Okay, they don't have any question.
Sandeep sir,
Sir.
all of them are medical students, right?
Yes, no, sir.
Or
Mixed
faculty.
category of
Or
students.
Right.
they
Now,
are
most
mixed
of them
category of
are either
students.
second or third year students.
Majority is having of medical student.
Yes. So they are the very promising people entering into the field of, entering into the world of genetics, and not genetics, entering in the world of, you can say, healthcare.
Yes. And many regional centers also joined, sir.
Yes. So whether you are coming from medicine or Ayurveda or homeopathy or any other field, let me tell you, you can't escape having the basic understanding of the world of medical genetics. You can't escape. And I'm sure that you must be having number of questions right now. I want someone.
Ask any question. IMT center, Nashik MHS, IMETT, do you have any question?
Was that useful? Was that helpful? Was that limiting? Did you get
100%,
anything?
sir. No doubt it is useful. I think there is a setting made by our hardware networking department. It's unmute. By default, it is unmute. I think. Anyone else want to ask any question?
Hello.
हाँ बोलिए.
Am I audible, sir?
Yes. First of all, tell your name.
I am Dr. Rishikesh.
Yes, Dr.
Ishram from
Rishikesh.
Swargीय दादा साहेब काडले.
सर दो स्पीकर एक को अनम्यूट कीजिए. Those are joining.
Sir, actually, I need to know about the what are the various implications of genetic testing in dentistry.
In dentistry.
Yeah.
Sir, if you just look at long back, it was even 15 years back, I had a talk on genetics of dentistry. It is so much relevant and so much, you can say, impactful in dentistry because face is the expression of most of the genetic disorders. Craniofacial genetic deformities, dental deformities are associated with most of the genetic disorders. That is one part of it. So from diagnostic perspective, not only for a genetic, you don't limit yourself only to the dentistry and the teeth. If you just look at something which is likely to be genetic, you can go for the overall diagnosis of the individual and manage that individual as a team. You from dental perspective, that is one part. Second part is dentistry is something wherein actually you can go in research to find out whether there is a possibility of regenerative dentistry through cell-based therapies and gene therapies. Huge potential. There are a number of conditions which we define there in dentistry, and you as a dentist can definitely enter into the field to do the diagnosis and management from the medical genetics perspective. Yes.
Thank you.
Anyone else?
Thank you.
Thank you, sir. So I think we don't have any question right now from the students.
Yes, sir.
I invite the question from email or by chat box. So thank you, Chopre sir, for giving you such a valuable time and the guidance. You have taken much effort for this presentation. Thank you. Thank you from MHS side. And once again, I will request all the SIP students and all the SIP nodal officer and vertical head that you need to join online on 18th of June at 2:30 p.m. So for tomorrow, day after tomorrow, on Monday, there will not be e-session. You have to go to the as per your schedule activities. That is what your SIP sector has given to you. But on 18th at 2:30 p.m., our Honorable Vice Chancellor, Lieutenant General Dr. Madhuri Kanitkar is going to meet you all online. So I request you to please join on 18th of June 2024 at 2:30 p.m. Okay. So with this, thank you very much.
Sir,
Thank
30
you again,
seconds.
sir.
Thank you so much. I want to
Sure.
thank you personally, Sandeep sir.
Sir.
I want to thank every participant, every student who has taken time to join this. I want
Yes,
to
sir.
thank the university
So
and the
next time
Honorable
we will
Vice Chancellor
invite you to the
for
online
giving
physical
this opportunity.
e-session, sir. We will invite you for physical session, sir. Where
Yes, okay,
there
thank
will
you.
be interaction with the nodal officer and vertical head. No, at that time we will invite you.
Thank you.
Much things to learn from you, sir. Thank you. Thank you very much.